Hey, I'm Dr. Ruth Roberts, your pet's ally. I hope you're doing well today. I'm recovering from a cold, so I'm going to apologize in advance, but I'm hopefully going to get through this without coughing and sputtering and all those good things. So, today is the beginning of our topic for May, which is how do you know what's really the truth? Um, the interesting thing is that it was. When the internet first started out, and I began using Veterinary Information Network back in 2009, and it was 1999, and it was incredibly useful because it was just like all of a sudden I had access to all of my colleagues out there throughout the country and the world, frankly, so to veterinarians, and we could ask each other questions and things of that nature. And so it was so helpful because we could get input on the cases that we were having difficulty with, we didn't know what to do next with, and it was just amazing. But what I began to realize is that it's still somebody's opinion and it's still how they solved a case. And that's still not a bad thing. But I think this is one of the main tenets of what I want to talk with you about today. So you guys are out there, and sadly, you're doing the research because many of my colleagues are not. And frankly, in my in 2003, I woke up one morning. Actually, it was January 1st of 2003, and realized that I was just nothing but a giant shill for drug companies. And what I was telling my clients was what the drug companies had told me to say. They were training us how to sell their products, essentially. And so that just was like, this is awful. What do I do now? And so what I had to do was start doing more research and start looking into things. At the same time, people were bringing me things they had researched from the internet. And so this was before smartphones, right? So they were literally bringing me stacks of paper this thick about, what about this, doc? What about this? What about this? What about this? And the thing is that I didn't know. And so I had to start researching every case that I was not sure of how to treat. And man, I was up late a lot doing that. And so this is kind of where all of this came from. So now there is a boatload of information out there all over the place, right? And you guys are just overwhelmed. You probably belong to several other Facebook groups where you're getting support for various conditions, because my profession has not been able to support you adequately for the most part, or because you have a particular belief set. And so what I want you to think about during this talk is to maybe get a little pissed off about what I'm going to say, but take it all with a grain of salt, because that's precisely what I'm trying to ask you to do. Take it all with a grain of salt. So a few things I want to lay out for you. So one of the things that is extremely popular for doctors to say right now, whether they are MDs or veterinarians, is that they are evidence-based practitioners. So that the goal with evidence-based medicine was to have a scientific reason behind all of the things that we recommend in conventional medicine. Well, it turns out that only about 12% of EBM recommendations actually have scientific basis. Kind of further to that point, when I finished veterinary school in 1990, I read several papers around the idea that, okay, here's your diagnosis, but let's see what the pathologist actually found. And so obviously these were people or animals that had died, but there was a solid diagnosis in the mind of the clinician that had treated them in the vast majority of cases. So it turns out that roughly 55% of the time, the doctors were right. Now, the only sort of silver lining in that study was that it still wouldn't have changed the treatment methods or outcome in something like 99.8% of cases. So that's sort of it. We doctors forget to be humble and realize that this is the best. This diagnosis is our opinion, and it is our best understanding of the information laid before us with the patient, based on either the patient's symptoms or uh, lab tests, things of that nature. So grains of salt, right? I had a, anyway, no, I'm not going to go there. So, so how do you know what the truth is? If in truth, the doctors are well educated and we all have very strong opinions because we're smart, right? Um, and we tend to not want to back off of our opinions unless we are shown otherwise. So how do you know when you're doing your research? So vaccines are bad, right? They're just bad and you shouldn't do them. Well, how about this? I was talking with a client last night. Her little pup is 15 years old and he now has pulmonary hypertension. So what if I told you that this dog had kennel cough when he was a puppy? And probably he was set up for some pulmonary inflammation and scarring at that point. And I can't tell you that this is why, but my suspicion is that this pup now is more at risk for pulmonary hypertension because he had kennel cough as a puppy and he had some damage to the lungs. And in fact, that's what, when I was in veterinary school, my professor said, well, what do you want to do with this dog with kennel cough? Well, so the literature all said, oh, it's pretty well self-limiting. And we were trying even then to start to understand how to limit antibiotic use. And so I spit that back out to him. I said, well, it's pretty self-limiting and it should go away within a couple of weeks. And he said, well, what if I tell you that it creates pulmonary inflammation and scarring and can lead to lung damage, which will exhibit later in life? And I said, sounds like it's time to give him some trimethoprim sulfa, which is the antibiotic of choice at the time. And interestingly, because it's not been used in decades, it's probably a good choice again. So does that make sense to you? All right. So we've got this poor puppy that could have had a kennel cough vaccine intranasally, not subcutaneously, because that one actually doesn't work. That one, there is pretty good evidence for that statement in the literature. Even the vaccines companies know it. So should all puppies have a kennel cough vaccine? Yeah, I think so. And that's why when I was in practice, first time I saw them, I gave them the intranasal kennel cough vaccine because I knew in 3 days they would be protected. Because you guys want to take that beautiful, sweet, happy young puppy and show it to all of your friends and take it to areas where, it's going to be around other dogs and other dog germs. Similar to that, we now have an epidemic of measles, and the epidemic number isn't so huge. It's 700 in the country, but it's more and more and more popping up. It is now April. These cases have been popping up in humans for months now. So there are several stories out there on the internet about mothers with infants that are less than the age of vaccination, which I think is 12. It's either 12 or 18 months. And I apologize, I can't remember the last number. But they're complaining because they can't take their babies out in public. Well, guess what? Don't do it. Same thing with puppies. I would love to tell you, please don't take your puppy out in public, because the other thing, aside from kennel cough, that it can get is parvo. So take it to areas, that are small. So this is why people didn't leave the house with infants until they were over 2 years of age. We did not, when I was a kid, babies did not go to restaurants in a little carrier thingy doodles, right? Because their immune systems were not competent and people knew that they were not protected against certain diseases. So this was not a problem for a lot of years, because there had been no cases of measles in infants, or people rather, from 2000 until 2015 or so. So this is why you just, that your pet's immune system is not competent, or your child's immune system is not competent to protect it from a certain disease. Don't go out in public and risk exposure. Yeah, I know, moms, it's boring. and it's lonely at home. But this is why this didn't happen. So, so just kind of think about that. Vaccines are there for a purpose. They prevent disease that otherwise would have either made you sick and created long-term effects. So, for instance, my uncle had rubella when he was a child, and yeah, that was not so great, and he was sick. But unfortunately, at the age of 60, he developed heart disease secondary to the rubella virus. So this is the thing, is that it's not just what happens now, it's what happens later in life. And we don't have that ability to see long term. And frankly, we don't have this in our current memory bank about what happens when you get a disease and then you have to deal with the after effects decades down the road for humans, and 7 to 10 years down the road for dogs and cats. So vaccines have a purpose. Again, my argument is that we need to have a rational conversation about what vaccines do and when to use them. And we sort of got forced into doing that in veterinary medicine back in the 90s, although many of my colleagues still do vaccines every year, even though that's been shown that that's not appropriate. So there you go. That's one of those hot topic issues. So your pet's got a particular problem, and you're researching the internet, and many of you come across the people that have a large audience. So, for instance, Dr. Becker and many other vets of that nature. And I'm going to single her out because she probably has the most massive audience. And what Dr. Becker is telling you are the things that she found to be useful in her clinical experience and the things that she believes to be true. I'm telling you the same thing. Can I back up everything I say with research? No, I can't. Can I back it all up with a paper? No, I can't. Part of that is because the research simply hasn't been done, and it frankly hasn't been done on the human side either. So there's these big issues with a lot of dogma, if you will, around it. Raw feeding, things of that nature. And so this is what you need to do. If you read an article about something, and again, an article is going to be somebody's opinion, and hopefully they've also done some research, and they're going to provide you with some footnotes. So what you need to do is look at those footnotes. How many of them come from the same source? How many of them are based on personal communication? If you're seeing an article that has footnotes, and many of them, I mean, most of my blog posts don't have that, right? And Jenna's writing most of that for me. So she's rewriting what I'm telling, what I've been telling people for a long time. Now, if you see an article that holds itself out to be a research paper or a scholarly paper, and you're seeing footnotes with all referring back to the same article or to things like the Merck Veterinary Manual or to personal communication, that's a regurgitation of information. So it's not that it's not valid, but take it for what it's worth. Now, if you're seeing a paper or an article that has a lot of footnotes with sort of 14 or 15 different scholarly references, then that's somebody that spent a lot of time doing research. Sometimes those references may be very old, dated back into the 80s and 90s. And the reason may be that that simply is all the research that was available on that topic. The other thing you need to do is then take that subject and plug it into, say, Google scholarly articles or PubMed, and see what happens, see what you get. If you get a bunch of current articles and they go against the point that that person was making, then they were editing out that information so that they could make that point that they believe in. Does that make sense? So that's the other thing you need to be really cautious about. Now, in your research, if you plug in a topic and you get 16 articles and they're all saying the same thing, then that's what's available in the mainstream media. And it's not that it's right or wrong. It's just that this is the current belief around that topic, or the current understanding is probably a better way to put it. So then is that adequate? Is that accurate information? And that's the thing where you have to now do the thing that is the most important. You are the person sitting in the room with your dog or your cat. You have to decide, does this make sense in reference to what I know from my veterinarian, what that person has said about my cat's condition? Um, does this make sense that this should be effective for my pet? So that's the thing that you really have to sit down and do. And unfortunately, it gets really confusing. So I talked on Tuesday to the Crock Pet Chefs group about heartworm prevention because um, there were some questions coming up about if your dog's healthy, it won't get heartworms. And I can't tell you that that's true. So what I told them was, it depends on where you are. So if you're in Utah and your dog is healthy, it's probably not going to get heartworms, largely because there aren't mosquitoes to much degree in Utah. Now, in South Carolina, if your dog is healthy, is it going to get heartworms? It might, if it's not on heartworm prevention. And I got to tell you guys, I started practicing in 1990, and every Friday afternoon at 5:30, I was treating dogs dying of heartworm disease. Now, were they getting heartworms because they were eating the kibble? I don't think so. They've been getting heartworms for decades and decades and decades, and it was a terrible scourge. So I can't really buy into that idea. So what I told them is, go look at the incidence map of heartworm disease, look at where you are. The thing that was hard for me to track down in there is that, and the American Heartworm Society makes reference to this, that below 57 degrees, the heartworm larvae cannot mature inside the mosquito to the point where they can infect the dog when bitten. Well, how long? And does that stop and it kills the heartworm larvae, or what happens? And I can't find the answer to that. So that I think is going to take about another hour's worth of digging through PubMed. Finally, I found reference in some of Dr. Dodd's work, and then also through some of the papers, that at 57 degrees it appears to stop larval maturation. But it still didn't say, well, does that mean that then they die, or what's going on, or just it has to take, So I think what happens is that it has to get warm again for that to resume. I don't think they die in that stage, unfortunately. And so that's the deal, so if it's been 57 degrees, so here's the story that's come out based on that. If it's been below 57 degrees for more than 5 nights, then the heartworms are not going to infect your pet. I'm not sure that that's really true. I think it really just delays the maturation, and it takes a while before it speeds back up. So for instance, what I can tell you, if 64 degrees is the high for the day for months on end during the summer, then it takes 2 months for the heartworms to actually mature to the point where they can infect your dog. So it's not that they're not there. It's just that they're in much, much less numbers. Does that make sense? The other thing I found out, so I'm going to correct myself here as well, was that the heartworm life cycle actually evidently has not changed that much. And so probably it is safe to use heartworm prevention every 6 to 8 weeks. And again, I think you need to base that on where you are. If you're in the Southeast, I would err towards the every 6-week side. And, if you're in an area where the infection rate is much lower, than maybe every 8 weeks. Here's the other trick with that. Ultimately, you have to remember when to give the heartworm prevention. So the thing to do is to do it when you can remember it. And if that's every 30 days when you write the mortgage payment, then do that. And remember, it's not that, so if on September 15th, the temperature dropped below 57 degrees, you don't stop heartworm prevention in September, because remember, it's backtracking 30 days. So you still need to give another dose in October to clean up everything that your pet's been exposed to in September and October. Does that make sense? So this is why it's so confusing, because it is confusing, and people pick something up and they don't quite get the whole idea out there and make it easy for you to understand what to do. So to that end, remember, you've got to choose what you believe is right for your pet and what you believe is going to support them the best. If you believe that raw diet is the way to go, awesome, go for it. If you're seeing your pet do well and thrive on it, awesome. But if you're like many of you that ended up coming over because you'd been feeding raw and you weren't seeing good results, you were still seeing GI issues, then don't be afraid to say, that's not working. Let's try something else. And I'll be the first to admit, I mean, I've had clients bring me research and I'll look at it and I'm like, that's an awesome idea. Thank you for that. You guys teach me so much. You force me to go beyond what I know and learn something new. And then in doing that, I can bring you something new. I can bring so many more people something new to try or to consider. And off you go. Here's the other thing I want you to think about as well. As I'm doing more and more consultations, you guys have been trying to self-problem solve for a while because you're not getting the information you need. And so many of you come to me during the consultation product and you've got your pet on 6, 7, 8, sometimes 12 supplements. And it's confusing. And what do you do? I mean, I used to say, okay, every dog needs sorry, brain glitch. Every dog needs coconut oil and fish oil and probiotics and digestive enzymes and a multivitamin and all, so those are just the baselines, right? Well, it's in time, what I realized is that digestive enzymes often don't help and they can actually worsen GI issues. So there are 3 supplements I will tell you that I believe that every dog needs to be on. And those are some sort of a multivitamin, preferably holistic total body support, because that's what I think works the best for most dogs and cats, and fish oil and probiotics. Now, do they need to take it every day? No, and there is some validity to the idea of giving your body and your pet's body some respite once a week or twice a week from the vitamins. So the multivitamins go back to that idea of getting kind of everything your pet needs and sort of covering up for any deficiencies for the diet in every day. And it goes back to that bizarre concept that we developed in pet nutrition, that they need to be eating complete and balanced diet with every bite. Well, that's ridiculous, right? I don't balance my diet every day. Do you? No, and that's not the way it works naturally either. You sort of eat what seems to either be around, or you eat what seems to feel right for the day. So I've been sick, and I just really haven't wanted to eat much. Is that a good thing? Probably so, because my body has enough to do to get rid of the evil spirits that have invaded it from my granddaughter. So eating a lot and adding digestive stress on top of the immune system stress I've already got, probably a great idea to eat a little less and let things be simple and easy. So that's kind of the idea. So is that making sense to you guys? And I see you've got some questions there, so I'm going to go back and answer those for you. And we'll go from there. So the one thing I do want to mention to you before I forget, because my brain's a wee bit scattered, is that I am honored and thrilled to be a speaker for a series called Pause and Effect. And this series was put together by a young woman named Janelle, who is a dog trainer, and she was frustrated because her clients were coming to her with all this stuff and all these things to try and improve the behavior. And what she wanted to do was to provide a way for people to know the basics about sort of really core issues: diet from a raw perspective, from a cooked perspective, supplements, behavioral training, things of that nature. So as far as I can tell, this truly is a free series, and she is not going to upsell you, or maybe she is, I don't know. But anyway, here's another source of information. So go check out that link I just put in and sign up. I think the series opens May 8th, and I believe it goes for 5 to 7 days, and I'm sure it will tell you all about that. But I think what Janelle is trying to do is the same thing I'm trying to accomplish. She's trying to help people weed out what's the truth. And ultimately, it comes down to two things. One is what's working for your pet, and before you try something, does it make sense to you, and is there enough reasonable backup to it to make it make sense? Is that clear? The other thing I wanted to mention too is something called cognitive bias. So, for instance, and I'm sorry I keep going back to vaccines, but it's like the hot topic issue. So our president initially said, no, don't need vaccines, all of this. And all of a sudden, he's saying, well, yeah, actually, you do need to go get a vaccine for measles if you haven't been vaccinated, because it does prevent disease. So this is the thing, is that the cognitive bias was there because we hadn't seen measles since 2000. So everybody got on this bandwagon of not giving vaccines because it was causing autism, which has been disproved. It turns out that fluoxetine, or antidepressants, which unfortunately many people take and many women were taking and are still probably taking during pregnancy, is a much more likely candidate for causing autism. Plus, there's a that's a whole can of worms I don't even want to get into. So, but our cognitive bias was that the vaccines had caused autism because a researcher said so. And then it turns out he faked all of his research, right? So for 10 years, we're like, oh yeah, this is cool. So now people that are in the anti-vaccine camp are using the Brady Bunch to prove that the measles vaccine that having measles isn't that serious. I mean, this is how ridiculous it's getting, right? So cognitive bias happens when you believe something, and even though you were provided with something that shows you that that belief is incorrect, you still believe it because that's where your brain got wired to. So this is the other thing that's really super difficult to overcome. So grains of salt, guys, just take everything with a grain of salt. See if your pet proves it to you or not. And what I'm not saying is to not try anything new or to get paralyzed, but try one thing at a time so you can see clearly, is this helping? Is it not helping? Because this is the other issue. I am horrified at the cost of some of the supplements that are out there. There's one that was produced by a fairly well-known veterinarian that is all proprietary, which means that you have no idea how much of what is in there, and you actually have no idea if this actually is a multivitamin that will balance your pet's diet or not. So, in the advertisement for it, this person says, well, really the trick is to actually feed your dog decent dog food. But then what he's actually selling you is the vitamin, because he's, instead of presuming that you're going to take his message to feed better food seriously, he presumes that you will not, but you will buy his supplement that will cost you $60 a month. Ludicrous, right? Okay, questions. So, thanks. And thank you guys for hopping in on this. I'm glad to see everybody coming on. So I hope I'm not rambling too much, but we'll go from there. So Sherry, yeah, your dog won't eat raw, but loves crock pet. Thanks. Mushroom complex, Lily. I think that medicinal mushrooms are awesome. There are a couple of caveats. So there are some dogs that actually have an allergic reaction to shiitake mushrooms. And those are the ones that were kind of promoted for a long time. Now, what seems to actually be a better idea are reishi mushrooms, and there's all sorts of stuff out there. Again, try it. See if your dog responds or your cat. Now, Does that mean that every well dog needs mushrooms? Probably not. Is it a good idea to maybe add some mushrooms every now and again? According to Chinese medicine, yes, because mushrooms dry up damp, phlegm. So that's, if that's something that your dog or your cat has issues with, it's probably a good idea to include every now and again. So again, rotation, rotation, rotation. If your dog has cancer, cordialis mushrooms are awesome. There are also reishi and cordialis and several other combos in there as well. Those are things that, again, those, find a brand that you trust. So for me, that was Con Herbals. They have a medicinal mushroom line. And so for me, that's the line that I trust. There are tons and tons and tons of this stuff out there, and they will tell you all sorts of crazy stuff about why theirs is the best and blah, blah, blah. So another example is MSM. That's something I started experimenting with myself. A fellow that I met turned me on to it. It was helping. He was telling me his product was the best because it was organic and made from trees. Well, it turns out that all MSM is made from a byproduct of the paper industry. Yuck. But it's, it is synthetic after it's been distilled down, and so it's still the same. So essentially all MSM is MSM, and it really seems to be the same. But that took a lot of research to find the truth there. So Beth is asking, if I give my dog sardines and salmon, do they need fish oil? And Beth, it depends on the dose. So for instance, if we're using 50 mgs per kg, 50 milligrams per kilogram of body weight of omega-3 fatty acids as a dose for things like cancer, arthritis, things of that nature. Does every dog need that dose every day? No. If your dog is predisposed or your cat is predisposed to things like asthma or arthritis, things of that nature, yeah, I think a little bit every day is good. Now, how much salmon do you need to feed to provide, say, 270 milligrams of omega-3 fatty acids, which is what the typical amount is in a capsule of fish oil? And the answer is you need about 6 ounces a week. So are they great treats? Absolutely. So again, it depends. So what's your goal with the fish oil? Is your goal to treat disease? Then yes, they still need a supplement. Is your goal to prevent disease? Maybe not if they're 1 or 2. So again, you have to kind of weigh things out for where you are. And cranberries, this has been another extremely well-marketed product on both the human and pet side. So what cranberries actually do is prevent the little feet, seriously, from Pasteurella, E. coli and Pseudomonas aeruginosa, which are the 2 main bacteria in urinary tract infections, from attaching to the bladder wall. And so when they are able to do that, so they're like glommed on, and this is what creates chronic urinary tract disease. So will cranberries prevent urinary tract disease? No. Is it a useful aid in treating a known bacterial infection? Yes, it is. So it's actually useful to prevent urinary tract disease. Guess what? Drinking water. So this is the frustrating thing, right? So women that have had a huge amount of urinary tract issues often, and cats for that matter, are often having them due to stress. And so what ends up happening is you end up with chronic bladder wall irritation. This is also happening in dogs as they worry more and more. So are cranberries going to help prevent that? No, it's not. Drinking lots of water, and then using things that will help reduce inflammation in general. So guess what that is? Probiotics, because many secondary bacterial infections in the urinary bladder are actually translocations from the colon, right? So the bladder sits on top of the colon, the bugs come right across into the walls. D-mannose is probably a better option for preventing recurrent urinary tract issues because it also helps to prevent those little feet from attaching, but it also seems to reduce inflammation in the bladder wall and get the urine out of there more frequently. And Lily's asking about the dental chews, and that is thisdogslife.co. Victoria, I'm not sure. Go sign up for the series, and I'm not sure what she's doing as far as repeating it or sending a transcript. So Teresa's asking, how many days a week should I give the dog vitamins? And I think probably taking a day off a week is a good idea. And sardines are great. They're awesome treats, and they're great motivators. So this is all good stuff. And Lily's heard that feeding raw is harder on the dog's digestive system, and I would have to agree with you on that. But there are dogs and cats that really, that's the best way to feed them. So, and the Solaris products by Dr. Harvey, the thing that disturbs me about Dr. Harvey's products is that he uses the same, if you look at the ingredients carefully, he uses the same vegetables on every batch, and basically he's changing up the protein. And while that's definitely a step in the right direction, it is still, I've seen sensitivities develop to these specific things, and broccoli, I think, is in every formula he makes. And Beth, you're right, the National Animal Supplement Council quality seal is helpful in that they're at least asking their members to come up to a certain level of standards. They're testing for contaminants. They're documenting when they receive the stuff coming into the plant, documenting when the stuff is going out. So if there is a recall on the supplement, they can tell you where the ingredients came from. And then the conifer mushrooms, shiitake mushrooms can induce an allergic reaction. And the mushroom products I've used in the past are Khan's myco herbs. So Khan is K-A-N. So that's what I know, y'all. Thank you so much for coming. Go check out the Pause and Effect series. I think you're going to really enjoy that. There's some awesome folks she's got on that are trainers that I think will help with some of the behavioral issues. So remember, salt over the left shoulder. Take it all with a grain of salt. If it doesn't seem reasonable, then it probably isn't. If all a supplement can tell you is a supplement selling page can tell you is testimonials and not the ingredients and what they are specifically, look for something else. Many thanks. You all take care. Thanks for the well wishes of getting better. And I'll see you next week. And remember too, so this is the last time that we will be here on Thursday morning. So next week it will be Wednesday at 7 p.m. Eastern Standard Time. Thanks.